In 2020, lawmakers passed a bill to raise the state's medical malpractice cap, which is now $5 million for hospitals and $750,000 for doctors. This session, they're backtracking, saying the high caps led to high insurance rates, so doctors left New Mexico in droves. News 13's Bella look at a bill to fix it and why attorneys for families are fighting it.
So let's create a healthcare landscape that attracts the best providers in the country right here.
At the start of the legislative session, Governor Michelle Lujan Grisham made it clear changes to New Mexico's healthcare system need to be made.
Insurance rates for doctors and healthcare providers shouldn't be higher here than they are in our neighboring states. And they most certainly shouldn't be twice the national average.
A bipartisan bill sponsored by Senators Martin Hickey and Pat Woods hopes to fix part of the healthcare system by revamping the state's medical malpractice laws. The bill was drafted by Think New Mexico, which published a report in 2024 that outlined how it'll tackle the shortage of healthcare workers in the state.
We're a state where there's no cap on attorneys' fees. There's no cap on punitive damages that can be awarded. And maybe it's not surprising then that we're number 2 in the country in the number of medical malpractice cases filed per capita.
The bill would cap attorney fees in medical malpractice lawsuits, end lump sum payouts from the Patient Compensation Fund, and send 75% of any punitive damages awarded to a new public fund designed to improve patient safety, all in hopes of keeping doctors in New Mexico who fear high insurance rates.
How did we get to this point?
It's a good question, Bella. And we believe that we got here because our laws are so heavily tilted towards lawyers instead of focused on patients and patient safety.
But New Mexico attorney Lisa Curtis says
the bill is horrid, right? I mean, it's a way for multi-billion-dollar corporations to make more money.
Curtis says it's not the solution, arguing the bill would also lower the amount awarded to victims.
These caps actually make it worse because it limits what their exposure is, even if they kill somebody. And so to a $13 billion corporation, having to pay $5 million out because they killed someone is nothing.
And her reaction to lowering attorneys' fees.
So it's wrong, but that's always where they go, is to try to kill the attorney's fees so that people can't get lawyers, so they can't bring cases.
But Senator Woods says the patient should be the main beneficiary.
Every dollar that goes to an attorney is a dollar that does not go to an injured patient.
While both sides disagree on how to make it happen, they both hope to prioritize the patients being impacted.
I'm offering a lot of different ways here, and hopefully something will come together to the benefit of the people of New Mexico.
Bella Olage, KRQE, News 13.
The bill still has to be heard in committee.